Okay, well, how about another really complex condition? This one not associated with cancer at all. This is an autoimmune disease. So, in my practice, I see obviously a lot of cancer patients. I do see a lot of autoimmune patients as well, because I do feel there's a lot of, actually, controversially, a lot of overlap between cancer and autoimmune disease,
There is,
in the
yeah.
fact there's a lot of immune system
Yeah.
dysregulation, inappropriate inflammatory markers going around.
Yeah.
And strange enough, I also see a lot of chronic fatigue as well. And I think that fits into the same triad as well. I see them as all three very interconnected, and usual similar herbs used in all have very good effects. But it's some of my doctor friends might pull me up on that as I couldn't prove that, but I really feel that greatly. So this was, again, a very complex case. Any autoimmune case, I think, really by default is a complex case, because there are so many different factors that lead to the autoimmune disease development, and it's always specific for that absolute singular patient. So that's when the need to have a very thorough, in-depth probing consultation and a very supportive therapeutic relationship, I think, is essential, because you need to really learn from the patient what has caused this. And that's when the doctors haven't got the time to do that, and they don't look at the cause again. They're just looking at the symptom, which is the autoimmune effect. So this patient was a 60-year-old professional woman. She suddenly came down with jaundice, was checked out, LFTs, liver function tests through the roof. Doctors kind of didn't know what was going on for a start. Lots of sort of different scans, MRI, CTs, etc. Couldn't find very much apart from enlargement of the liver. So they had to go into a biopsy, which is not the most pleasant thing. And of course, that showed immediately autoimmune hepatitis. A patient was put onto the usual protocol of steroids. I think it was budenoside for a short time, and then moved on to I think it's azaprine. Azathioprine. Sorry, and and things started to get better, but her liver function test really didn't go back to normal, and she was still feeling rather unwell, nausea, recurrent UTIs, redness on face. She felt very puffed up, she said, and she wanted some help from me to support her going through the conventional treatment, which I was very happy to do. Obviously we know that steroids are lifesavers, but their side effects are quite severe, and the same with the azathioprine. It's absolutely essential, but it does have side effects. So I had a chat with her consultant, her GI consultant, and he was okay for me to use herbs. He said, as long as you're not going to tell the patient to stop all the medication. I said, no, I work in an integrated way. So I'm there to support the patient and to support you in what you're doing. I work with you. I'm not working against you here. And so, I told him what I was going to suggest.